Hey loves, welcome back to my channel. It's Nurse Michelle here. You're on a channel where I make nursing videos, lifestyle videos, and occasional travel vlogs. So today this video is going to be about COVID-19, coming from a registered nurse's perspective and what's currently happening within the health system that I work in right now. So let's get into this video. So COVID-19, also known as coronavirus, is a viral infection that is spread through fecal and oral matter, meaning that it can be spread through stools and oral secretions, mainly affecting the respiratory system, meaning your lungs. So symptoms of coronavirus. So if you're having shortness of breath, if you're coughing a lot, if you have a fever, these are all signs to look out for if you think that you have contracted this infection. So a lot of people who contract this virus may be asymptomatic, meaning that they're not showing any signs of it. So people who are more susceptible to becoming extremely ill from this disease, which are the elderly, people that are older than 60 years old, and the immunocompromised population, people with multiple comorbidities, smokers. These people are at a higher risk for becoming extremely ill from this disease. This infection can range from being benign to very severe. Severe in which, of course, it affects your lungs. It can lead to pneumonia, which can lead to ARDS, which stands for acute respiratory distress syndrome. And at this point, you are dependent on a ventilator to support you. ARDS can then lead to septic shock, which is when your body becomes severely hypotensive. Oxygen isn't getting to the needed organs, which can lead to multi-organ system failure, which then leads to death. So there's a lot of commotion about this virus because it spreads rapidly. This is why the CDC, the government, the WHO have been, educating people on practicing social isolation so that you're not as exposed as much to this virus as you would have been if none of these regulations and guidelines were set in place. Ways to protect yourself from this virus is, of course, hand hygiene, washing your hands with soap and water for hand sanitizers. Try not to touch your T-zone as often, which includes your eyes, your nose, and your mouth. Try to stay away from that. And of course, social isolation, which I mentioned already. Taking multiple showers. Basically, practicing a good hygiene. Practicing good hand hygiene, practicing good overall hygiene is the most preventative way of acquiring this viral infection. So that's the breakdown of coronavirus coming from me. So I'm gonna then tell you guys how it's affecting my healthcare system and how it's affecting my job. As you guys know, that I am a recovery room nurse. I work in the post anesthesia care units. I also work in the ICU, but right now I am in the PACU. So because of how widespread this disease can get, the nation is trying to, take precautions in where we can be, us the healthcare system can be better prepared, to take care of patients in case they get potentially ill. So because of this, I work in the surgical world. The Surgeon General, made a statement a couple days ago saying that, healthcare systems should consider cutting back or stopping completely elective surgeries, which will then, provide room for the future coronavirus patients that we will get. So with that being said, my health system released a statement saying that we are cutting back and scaling back on all elective surgeries. So that cuts my department down quite a bit. I work in the surgery world and where we do tons of surgery. So if we're cutting back on our electives, then that cuts our patient population in half. So elective surgeries including a lot of the non-emergent cases, like a lot of the plastic surgeries and a lot of the total knee replacements, total shoulder replacements. So yeah, surgeons are cutting back on elective surgeries to potentially make room for the influx of patients that we're going to get in the future. We don't want the health system to get to a state where we need beds, we need hospital beds, but they are being occupied with people who did surgeries that were not necessarily emergent. We need to save these hospital beds for the important cases, the emergency cases, and that's basically where the health system is shifting to. Contact precautions and droplet precautions is what we will be using to take care of these patients unless otherwise indicated. We will be using airborne precautions, so the N95 mask and aerosolized procedures. And aerosolized procedures includes, of course, endotracheal intubation, which a lot of these patients, if they are extremely sick, will be intubated. So that's when we're told to use the N95 mask or to use airborne precautions. Aerosolized procedures such as the use of BiPAP, CPAP, nebulizer treatment, tracheostomies, bronchoscopies are going to be, utilized wisely. Even so, with the CPAPs and the BiPAPs, I think I work with a nurse who works in the ED, and she is saying that they're not even doing that. They're going straight to intubating patients and taking and providing care that way, just because of the risk of the particles floating into the air and of course spreading even further than it's necessary. So they're not even considering putting patients on BiPAP or CPAP. It's just straight to intubation and straight onto that. And it's so scary. I've been reading articles, if it gets so bad that patients are going to have to share vents. One vent per 2 patients. There may be lack of supplies, lack of medical supplies, which, isn't good because us, the healthcare providers, aren't protected from taking care of these patients. So, I think we are trying to prepare for the worst case scenario possible, and I don't see anything wrong with that, and that's why these precautions are being proclaimed out there that people should follow, so that we don't get to this point in where there's lack of supplies and there's just a lack of healthcare workers to take care of people. In terms of also protecting patients and us as the healthcare system, we've cut down on visiting hours for patients, even though it sounds really bad because being in the hospital, patients are extremely vulnerable and they need family and supports. It's important that we try to minimize visitation so that the patients aren't coming in contact with potentially infected people, or people aren't bringing the infection into the health system, or even us healthcare workers, transmitting that infection onto people, continuing the spread of the virus. So our hospital visitation hours have been cut down. I think it's so minimal now. People are not allowed to stay over if you have a loved one in the hospital. Even in my recovery room, we used to bring family members into the recovery room to see patients. We've stopped doing that. So we're taking measures to try to minimize the exposure to this virus as much as possible. Also, to minimize exposure to this, my hospital are now calling patients in the day before their surgery to ask them if they're experiencing any symptoms of this viral infection. So if they've been coughing, if they have a fever, if they're experiencing any shortness of breath, they should let us know so that we can move accordingly. Recently we had a patient who was scheduled to have a knee replacement, and she came in with a cough. Our criteria is if they have more than one of the symptoms of this viral infection, then they should stay at home. They should not even bother coming to the hospital. So this lady only had the cough, which of course, granted, she didn't check her temperature at home, so she came in. So she came in because we were aware of the cough that she had. We immediately gave her a mask and then, of course, sent her into the isolation room. So in the isolation room, we checked her temperature, we checked her vital signs like we usually do with every patient, and, she spiked a fever. So with that being said, we called our anesthesiologist into the room, and they did their assessment, and they decided to cancel the surgery because she's met the criteria. And of course, she's going to get further testing to see if she does indeed have this viral infection. So yeah, that's one case that happened. This lady, instead of getting her surgery, went home because she is showing signs of this potential viral infection. So yes, our hospital is doing a lot in our power to try to minimize the exposure that we will have to this viral infection. That's what's going on in my healthcare system, in my department, and in my world as being a registered nurse. Thank you guys for watching this video. I hope you found this helpful. Share with me your thoughts. What's going on in your hospital? Share with me in the comments below, and I'll talk to you guys later.